thank you so much. I'm really so excited to be here today, and I really want to acknowledge the wonderful work that the committee the Allied Health Assistant Committee have gone to today. It's just fantastic, the work, and I've seen that this conference grow over the years. And last year we were really worried about putting it online and would it be as engaging and would people enjoy it as much, but we found some absolute positives out of it moving online, so that we now have people from New Zealand, from all over Australia coming to this conference. So that's just fantastic that we can share the learnings right across our beautiful land and across the beautiful land of New Zealand as well. So I have got the great pleasure of talking about the value of allied health assistance. And this is something that I actually really believe in, and it's something that has really grown here at Monash Health. We're very lucky to have Lucy as our allied health advisor, and we have a number of allied health assistants in what's called the WISER unit, which is the Workforce Innovation Strategy, Education and Research team. And we're really looking at the roles of allied health assistants and how we can grow them across our organisation. I've had the very great pleasure of reading all of your posters, because I was asked to find some awards for today, and I've looked at a number of your lightning presentations, and I was really reflecting on there's such a wide range of roles that allied health assistants are taking, from mental health to the more traditional orthopedic sort of physio OT roles, to roles helping people with their telehealth. Just the range of roles that you've taken is just really fantastic, and that will continue to grow. But I really wanted to make sure that you know just how important this support has been to your patients and also to your colleagues. So COVID has meant that, particularly in the inpatient setting here in Melbourne and in Sydney, I think as well, patients have been unable to have visitors. And particularly for COVID positive patients, actually getting COVID is one of the, I think it must be such a lonely thing, because you do end up very isolated. And even if you're an inpatient, some of your care will be being delivered remotely. So that means you have less contact with people, which is much safer for the people caring for you. But I think it must be very lonely. And I think that allied health assistants have really helped to break down some of those barriers and really helped the whole person. So what I'm going to do is read some feedback that we were given about a couple of our allied health assistants. So this is this is one of the pieces of feedback that I shared with all of our allied health last week in our allied health forum for Kindness Week. So this patient writes that I'm providing feedback on an allied health worker. I'm in my 33rd week in hospital with pancreatitis, and I've endured many surgeries and procedures. I'm extremely grateful for the care I've received. I want to especially thank my AHA, as she goes above and beyond, not only to get me moving, but to keep my spirits up. She supports me with my physio and pushes me to get me achieving more and more, so that I'm walking distances I didn't think I could and reaching goals I thought were beyond me. She cares about the whole person. She's come to know me and my family, and this helps a lot, especially as it's months since I've been able to see most of them. I'm able to chat about people and things that are important to me. There are many disappointments with being in hospital for so long, and Tracy has helped me through a lot of these. She decorated my room in Western Bulldogs colours, together with the photos of my family on grand final day. Another thing Tracy does is that she takes progress pictures on my phone and sends them to my family. I hope she's commended for her expertise and her professionalism, but also the extras she does with a smile. And that is I think that one of the key values of the allied health assistant. They get to know the whole person and find other ways to really support them. So some of the roles that allied health assistants have been taking during COVID-19, your roles have become so varied. So we're employing allied health assistants on our wards now to help patients with meals and some of the other care that they need on the wards, because we have some challenges with staffing, and so we're finding more and more roles that we can employ allied health assistants in. And you're such a flexible group that's been really fantastic from a workforce point of view. So in the different pieces of information I read before today, I was reading about a veteran from Western Health, and she has had so many different roles during the 2 years of COVID that we've had here in Melbourne. So she's done roles from screening in the emergency department, she's been assisting with swabbing, and then she was contact tracing. And Tony, who's one of our fabulous allied health assistants, has done a lot of contact tracing as well here. We're including the allied health assistant role in a new emergency department allied health navigator team. So the role of that team is to work with COVID positive patients in the emergency department to avoid admission, sorting out social and housing issues, and making sure that people get things like the food that they need to help them to be able to isolate safely. I was reading one of the posters about allied health assistants working in pulmonary rehab for patients with long COVID. And hopefully we won't have too many of those, but that is certainly one of the outcomes, that we will have some different health conditions that we need to manage at the end of this period. We have an allied health assistant role in our new geriatric and evaluation at home team, or the GEM team, and they'll be supporting our physiotherapy and occupational therapy teams. We have COVID pathways, which we have allied health assistants helping to deliver some of the things that help our patients stay safe at home and well at home without having to be admitted to hospital when they're at risk, but they also have COVID-19. So this is part of the care that we wrap around people when they are COVID positive, so that we can keep them safe at home. I was reading about some of the wellbeing phone calls people have been doing for people with aged care, people with mental health conditions, really increasing that social bond, which is so important. Some of the allied health assistants have been assisting the allied health professional students in orientation and at the start of their clinical placement. And I certainly remember many moons ago when I was a student, it was always the allied health assistants who knew where everything was and knew how everything worked. So I think that's a really great role for our AHAs to take. And there's many other innovative roles that I've been reading for that in all of the work that you've done that are not related to COVID, such as screening children's hearing, teaching older people how to reduce the risk of falls, delivering healthcare to clients with acquired brain injury by telehealth. So I just wanted to share with you another piece of feedback that we've had about one of our allied health assistants. And this allied health assistant's role, one of her roles is to teach our nursing staff on the wards about malnutrition screening. And the feedback from the nurse manager was how great that training was. It was so engaging and interactive, and they had a really good turnout of nurses to come and attend that. And I think it's really great to see these different roles that our allied health assistants are taking. And that, so I guess when I reflected on all of the things that I've read in the last few days about allied health assistants, and what I've learnt over the years is that particularly our multidisciplinary allied health assistants really are the linchpin of patient care quite often. They're the ones who know the patient better than any other health professionals because they've taken the time to get to know them. This human connection is one of the keys to the value of allied health assistants. I want to let you know how much you mean to our patients, to their families, to the allied health and other professionals that you work with, and what a vital part of the team you are. This role will only increase in the coming years, and I really hope that you have a fantastic day today. Get really inspired by the work that your colleagues have been doing across the country and also in New Zealand, and pick up a few different ideas, but just really enjoy celebrating what it means to be an allied health assistant. Thank you.